So this is another patient who had an endophthalmitis and a retinal detachment. And again, he was PL plus PR inaccurate. But she was one-eyed. So we went ahead with the surgery. We did what I thought I did a very good job. I removed all of these membranes, all of the vitreous, and then settled the retina. There was a small membrane which was fixed, and there was a small bleed here when I removed this membrane, but that was again controlled. The posterior hyaloid was peeled off to the extent possible. I think I thought that we had done a very good job. We settled the retina and we put in oil, and the patient recovered a bit of vision. She was one-eyed, in fact. And I took her up for silicone oil injection, silicone oil removal, and you see the removal was very smooth. Here's, you see, after 3 months, the removal was very smooth, and you can see there was free flow of fluid from the cannulas. Once the oil was out, you can see the fluid was flowing freely from both the cannulas. And then I thought I'll just put in some air after removing the epiretinal membranes. But as soon as I switched on to air, the retinal view became hazy, and you see suddenly the air had gone into the suprachoroidal space. And before I could think something of it, the choroid ruptured, and you see this air bubbles popping out from into the retina. And I again checked, the cannula was still in the vitreous space. I just cleared some more. I thought I'll just clear some more vitreous from here, and then again went inside, and you see this, the air was still in the suprachoroidal space, and you see it was popping out from the choroid and the retina, through the choroid and the retina, like this. These air bubbles were just popping out like anything. First of all, that was a very scary moment for a minute. I thought what to do now. Again went in, cleared all the things. Then I thought I'll just push in air and more air, and did a 26 gauge needle, used 26 gauge needle to remove the suprachoroidal air. So the air then again that pushed that I was injecting in the vitreous pushed the suprachoroidal air out. Then I lasered the rupture site all around, and I did a 360-degree laser also. And then silicone oil was injected under direct observation, because I was worried whether it will go through the choroid into the suprachoroidal space. This patient, though the patient is having a little bit of vision, the visual result was not as good. She was just able to see counting fingers close to face after this surgery. So this was one case which I was totally confused what to do while